So if we don't find T790M, we look for trials because there are some with combinations of EGFR TKI plus something else trying to get that response up, even though there isn't the T790M. But we also have chemotherapy. And that is really, most EGFR mutant lung cancer is very sensitive to chemotherapy, and so it's important that as we're talking with our patients, even from the beginning, even as we are excited that they have EGFR and we can start on that therapy, that we start talking about chemotherapy then, so that when the time comes, the patient's prepared for it, and they actually, many of them do quite well. I didn't in my talk, but I think that that's, if someone starts on a first or second generation drug, next line is going to be osimertinib or one of the other drugs that are being developed. There are a lot of other EGFR TKIs that are being developed, or chemotherapy. If we start with osimertinib first line, then we're starting to understand more about what does that resistance look like. If you get C797S resistance mutation without the T790M, then perhaps some of the first and second generation drugs could work. Whereas if you have both, that's not the case. So again, the more we know, the more we understand that it's more complicated than we think it is.